Over the past few years, I've learned to listen carefully to what Geert Vanden Bossche says and understand that timelines are difficult to predict. Many people ask, like, when is the earthquake going to happen? Or what time will the volcano erupt? What you have to look at are the signs, and predicting the exact periods can be quite difficult. And this is what Gert alluded to. However, he said something towards the end of that interview that really stood out to me as being the most serious warning. And this is what I'll be playing for you shortly. If you want to see that, you have to just go to my link in the Substack and you will see Gert's new predictions 2025. I've got here the full 1 hour and 42 minutes there, and it's broken down into time codes as well. So if you wanted to see exactly what he said according to your interest, you can see all of the periods going all the way down to the end in 16. So 16 different time code periods. So very important to reflect on what he was saying. So what I'll do is I'm going to play the clip of what he said, or the bit that really stood out to me as to what he anticipates is going to happen. But he's learned his lesson not to try and put a time on it because this is complex. And then I will explain to you the kind of choices that have to be made, because that's the reality. If I took you back to the start of the pandemic, what would you advise at that point? How would you protect the population? What would you do if you were put in charge? Those are the kinds of questions that we have to answer. But let's listen carefully to what Gert had to say. It's about 5 to 7 minutes, just 5 minutes long, actually. Let's hear his perspective.
We're not there yet, because what that means is that the final stage will very simply be reached when those, who have no immunity left, unfortunately, have been eliminated by the virus, and when those who have strengthened their immunity will eliminate the virus. And that will be the end of the pandemic. And we are not there yet, but any situation on this path that is unstable, or that looks stable, but it isn't stable. We have right now a situation that to many people looks stable. We know it's not stable. We call this metastable. It's a temporary equilibrium, but it's going to evolve. And that is how some people, some public health authorities even, or so to say, leave people with the impression that the pandemic is coming to an end because we are seeing less hospitalizations due to SARS-CoV-2, mortality due to SARS-CoV-2 is still relatively low, wastewater levels are still relatively low, etc. So for them, it's a transition to the endemicity of the virus. On the other hand, we know very well that the virus is still evolving, and that the trick that the virus is now implementing is that it transmits through asymptomatic or mild infections. People who develop still this infection, very often they are mild, they can be prolonged, etc. But these people are not necessarily in bed. These people are not necessarily hospitalized, so they are in society. They spread the virus, and secondarily, the virus is highly infectious. The SARS-CoV-2 virus is highly infectious. So even if the shedding is reduced, because big chunks of the virus are now just sitting on migratory dendritic cells, I'm explaining this in my course, in my book, etc. So it's taken out a lot of the viral load, and so the wastewater levels is relatively low, but the virus is still highly infectious. It's asymptomatically transmitted, but it has more and more difficulty, of course, to transmit, which puts the transmission of the virus under huge pressure. And we have seen all the mutations right now that still occur, or improving, so to say, the transmission. But this pressure is not going to go away. The only way to relieve it is if what I'm saying is going to happen, that those who can still contain the virus by kind of sterilizing immunity will eliminate it, and those who cannot do this, they will. I mean, that is for me. That is for me very clear. They will get eliminated by the virus, so the other way around. But again, what I'm saying is that right now there is an opportunity for those who got vaccinated, didn't get the live attenuated vaccines recently, to simply get exposed to what is circulating, to not vaccinate, to not mask, and and of course only under the condition that they are not immune suppressed. I know this is very sober what I'm saying, but if I were a public health authority, I would not be allowed to say this. But this is the only reality on how you can end this pandemic. You have to stop the transmission. Nothing right now is stopping the transmission. You don't stop the transmission, this thing goes on, you get reinfected, the chronic diseases based on this immune dysregulation will just continue, you get more excess deaths, you will get more cancers, you name it, and the thing is still going on. This will not be the end of the pandemic. Mitigation is not a solution; it's a snapshot. This ecosystem will evolve towards a situation where nature will re-establish a sound equilibrium between these pathogens and the immune system, the human immune system at a population level. But it will come with a price to pay because we have messed up miserably this ecosystem by the faulty infection prevention measures that we took at the beginning of the pandemic and then followed by the mass vaccination campaign. So Africa will win.
And that was the sobering thought that Geert had said. Listen, you have to understand, as I said, I have spoken to Geert probably the most, so since 2021. And so I have a unique perspective on what he's saying. And so I'm sharing with you my understanding from both pre the interview and after, because I have the luxury of talking with the interviewees afterwards as well. And what is clear is that there has to be an acknowledgement that deaths will occur. And when I look back at the beginning of the pandemic, this is why I asked the question at the start, what would you choose now that you have 2020 vision? And what it made me reflect on is a few things that I think that I will share with you quite quickly. And that's to do with Norway and Sweden, comparing them in terms of mortality in the pandemic, because Sweden took an approach of they didn't lock down. Norway was one of the most strongly locked down regions, certainly in Europe. And the question is, well, what were the outcomes? What was the right thing to do is the kind of question that we should want to look at. And when you look just broadly at the numbers, and this is what you would see when you looked at Norway versus Sweden. So Sweden is in blue, Norway is in red. This is from 2020, and this is to 2022. And what you can see are these big peaks in terms of the numbers of deaths in Sweden, comes down, and then they kind of tail along together till 2022. And so this would give you the impression that what happened with Norway doing the lockdown, then the aggressive vaccination program was the best way of doing it, and Sweden lost out. But you have to remember that these numbers here represent the fact that Sweden has double the population of Norway. And so you have to then look at it a little bit more closely. And that's another paper that then compared the excess mortality between Denmark, Finland, Norway, and Sweden between the periods of 2020 to 2022. And so when you look at that image, and I'll show you just in a second, that image shows a different picture when you look at it according to excess deaths by population numbers. And so when you look at this here now, as you can see Denmark, Finland, Norway, Sweden, and in each one, this is April 2020 all the way to December 2022 in each one of these here. So you can see Denmark, red means excess mortality, blue means less than excess mortality, and this is excess deaths per 100,000. And so you can see Denmark, it had some deaths early. I think this would have been lockdown. And then after May 2021, they'd have had vaccinations, and deaths then were kind of stable, rising towards December 2022 with, and that was about the time of Omicron. Yes, that was the time of Omicron. Um, Finland, you can see here, they again did a lockdown, but you can see what happened with excess deaths after they opened up in May 2021. Norway, who we compared to, when they did the aggressive lockdown, they had lower mortality initially, but then when they opened up, you can see the mortality rates here increasing but relatively stable. Comparatively, excess deaths per 100,000 for Sweden, they had the two big peaks because they got to herd immunity quickly. And then you can see that here, their excess deaths were lower than all of the other regions. What was unusual about Sweden is even after they made the population face the virus, they then still did a relatively aggressive vaccination campaign to get hybrid immunity. But that's a different discussion. However, what it seems when you look at it this way is that essentially Sweden had the best outcome by facing the pandemic. And it's demonstrated even more clearly here when they look at excess deaths per 100,000. So in 2020, yellow is Sweden. They had the highest excess deaths here. But in 2021, they had the lowest, and as well in 2022, with Finland having the highest rising excess mortality throughout the period. So it suggests that facing the pandemic in retrospect may have been the best thing to do and to take the hit in terms of mortality. And that's kind of like what Geert was saying in March 2021. He says, don't do mass vaccination. I don't think he wanted any vaccines at the time, but I think subsequently he thought maybe at least just a high risk. But if we had faced that pandemic, we would have had a situation like Sweden, where there would have been a lot more deaths, but largely facing the pandemic, it would be over. Kind of like what has happened, say, for instance, in Africa. Granted, they didn't have deaths across the board, which, again, inconveniently, nobody wants to look at, but that's a different conversation. So it raises a question again now. And this is why I'm speaking about this, because based on what Gert is saying, is that we are at a point where, with the high circulation of virus, something has to give at some point. The question is when. The longer the virus circulates, the more damage it does because of the recurring infections. And what you need is you need the population to get to herd immunity, where it's very difficult for the virus to circulate easily and it can't get around as much. But in reality, that can only happen when people who are transmitting it then are no longer there. And that's effectively what Geert was saying. Now, when I think back to the timeline as to what he said in 2021, he predicted that the mass vaccination would lead to variants. Many people still argue that that was incorrect. However, when we look at the variant tree, and I've gotten this here from just showing you here, this is about the World Health Network, looking at the way how we name variants. And it has here, this is the variant tree. And you can see here, you have alpha, there's delta, beta, epsilon, and all of these variants here. In early 2021, they were arguing that this was caused by the unvaccinated cohorts who were doing or causing these variants to occur, which to me didn't make sense because, why would the unvaccinated drive variants when in effect there is no need for a variant to form because there's no pressure, they'll just get infected. But that was the narrative that was being pushed at the time. But when you look at where it is in terms of Omicron, now you have to remember, if you were continuing to name these variants according to this pattern, you would have run out of names now in terms of Omicron. So, one of the things that people get confused about is they keep on thinking that, well, it's just Omicron. In reality, these are all multiple variants that would have been named differently. But to highlight the point in terms of what Geert was saying, was you have to now think about the timeline when he said it in March 2021. Now, look at what happened here is that you can see here, you probably can't see this here, but this is December of 2020. They have some variants here. And then by about March of 2021. So this is about where Geert was speaking in March of 2021. And at that time, you had a number of variants here, which continued to evolve, but not significantly until about January of 2022. And then we started to see the beginning of Omicron. And even then, it was just Omicron. But then suddenly this starts to break out into all of these variants of Omicron in highly vaccinated regions. So, what the point I'm making to you is that from the time that he was concerned to the time that you see the full evolution of it is almost 2 years. And this is part of the problem, is that people underestimate what he's saying because the timeline isn't necessarily the way that they would interpret it. And so what he has said is effectively this has to happen. You can't tell when, but it is not possible for there to be this much viral circulation ongoing with production of variants after variant and it not have a disastrous consequence on the population. And so this is now where the timeline comes. He was saying that if you try and slow it down, do you end up similar to what happened with Sweden or the other countries that tried to slow it, more deaths in the long run? Or do you just face it? Face it, accept that there are going to be a lot of deaths, but at the end of it, you would have moved past it as a population. And so this is now a long term question and not an easy one. And I don't envy public health in terms of making these kinds of decisions, but these are big decisions. And I don't think any way they take it, anybody ever will be happy. But somebody is going to have to make the decision. At the moment, the decision seems to be let it happen because there is not a lot of pressure in terms of vaccination. There's not a lot of pressure in terms of masking. A lot of people on the other side are saying you've got to do something. It seems that quietly the politicians and public health are taking the stance that they're not going to intervene anymore. The only worry I have is that based on prior experience, I'm not sure if they're doing this for their own protection or for the benefit of the population. But that's a different point for a different time. There are no easy answers here, and I think that's the point that Geert had pointed out. We have to face this, and there will be deaths. The question is how many and how early do we do that? That's a tough one to be able to answer. Thank you all for listening. And as usual, look in the description. Coming up in just a few days is Autoimmunity 101, as well as the fact that you have linked to our number one book, which is Disease X. If you join us with regards to this journey, this is why it was written, because I think we're going to need to all be prepared. This is not going to be an easy period of time. Have a great evening.